Welcome to our integrative review on the evidence-based practices of stress urinary incontinence in postpartum women. Throughout this presentation, we will discuss the purpose of this review, give a background on the topic, as well as discuss the methods our group used to research literature on this topic. We'll go over the results and what we recommend for practice as far as what healthcare professionals can do to treat these patients and why it can make such an impact on these patients and their quality of life. First, I want to start out by introducing our group members. I am Alexandra Waguespack. I am a registered nurse. I have my BSN, and my focus for school is women's health nurse practitioner. Our next group member is Bellard. She also has her BSN, and she's a registered nurse for same-day surgery. Her school focus is women's health NP as well. Our next group member is Childs. She's a registered nurse. She has a few certifications from when she worked labor and delivery, but lately for the last few years, she has been working in a fertility clinic, and her focus for school is women's health NP. Our last group member is Alexandra Frey. She is a registered nurse in same-day surgery and the emergency room. Her focus for school is family nurse practitioner, and she also has her BSN currently. So we'll start out by going over the purpose of our integrative review. Thank you.
Hi, my name is Childs, and I'm going to be reviewing our purpose for our integrative review, which is to analyze the existing research on the evidence-based practice treatment methods to eliminate urinary incontinence in women after childbirth. Since many women suffer with involuntary incontinence after pregnancy and childbirth, analyzing the collected data on treatment options can enhance evidence-based practice in an effort to alleviate distress and the experience for postpartum women. Our practice question is, what are the evidence-based ways that have been shown to decrease urinary incontinence in postpartum women? And breaking down the PICO question is, our population is pregnant and postpartum women. Our interventions are pelvic floor therapy of varying modalities. Our comparison is non-applicable, and our outcome is to decrease urinary incontinence after childbirth. Postpartum urinary incontinence background is that it is a common complication experienced by women after childbirth. According to Jejun et al., 25 to 55% of pregnant or postpartum women suffer from this condition, with 3.7 to 19% of women experiencing it after their first vaginal delivery alone. Various interventions can help reduce the incidence of postpartum urinary incontinence, and conservative interventions are usually preferred over surgical interventions or medication-based treatments. Several factors contribute to urinary incontinence in the postpartum period, but childbirth is considered the biggest and primary risk factor. Other factors include obesity, prolonged labor, and multiple childbirths. It has been shown that urinary incontinence in postpartum women reduces quality of life and also is a hindrance in the activities of daily life as well. It's shown that pelvic floor muscle therapy and other conservative treatments have been proven to aid in both the treatment and prevention of this urinary incontinence. And while there has been some debate in the past regarding the effectiveness of conservative treatments initiated after childbirth, research shows that they are significantly more effective when used for prevention during the prenatal period. And our integrative literature review is going to go in more depth regarding this.
Everyone, my name is Alexandra Frey, and I will be presenting the methods section of our poster. So we'll start with the literature search. As part of our research, we conducted this literature search to gather relevant information from previously published studies. To keep the data organized, we used a systematic platform called RAN. Our objective was to analyze the existing literature to answer a specific question with the hopes of advancing evidence-based practices in nursing and other fields. While there are numerous ways to collect data, technology has made it easier to conduct research through electronic databases, and these databases have proven to be very dependable resources for our data collection. This literature search was conducted using the electronic research databases to gather the specific data. We have included the inclusion and exclusion criteria to ensure that we selected the most relevant data for our study. We set these inclusion and exclusion criteria by a group effort by all four in our group, and were designed and targeted of the population of interest. We thoroughly reviewed each article's abstract to determine if we met our criteria. The inclusion criteria includes articles that had to be peer-reviewed and published in English within the last 7 years. Also, our focus was on women who had previously given birth. The exclusion criteria, this includes studies completed on male subjects and women who were not postpartum, as well as any other data published before 2016. This was all excluded, by eliminating these factors outside of the selected studies. Reviewers, so all four reviewers can draw the most reliable conclusions. The databases that were used for our current literature search includes PubMed, and this includes Medline, the Cumulative Index to Nursing and Allied Health Literature, also known as CINAHL, and Embase. In addition to formal research, there were also observations in each of the individual's daily healthcare practices that were also utilized. Apart from the databases that I just mentioned, there were numerous other helpful resources such as websites, peer-reviewed articles, and journals that were not included in this study. Some of the supplementary search methods, these include the American Journal of Obstetrics and Gynecology, the Journal of Clinical Gynecology and Obstetrics, and the International Journal of Gynecology and Obstetrics. Thank you so much, and results is next.
Hi, my name is Brandy Bellard, and I'll be discussing the results of our integrated review. 16 articles met the inclusion criteria set by our group, and each of them was divided amongst the 4 members. The articles were analyzed and compared, finding both similarities and differences within them. We then began to compile and examine the data found in the articles. We identified the outcome measures along with the discrepancies and gaps found in the literature. After analyzing various research study designs, it became evident that the use of pelvic floor physical therapy can optimize a woman's quality of life as it reduces the episodes of urinary incontinence. Pelvic floor physical therapy strengthens the muscles that support the pelvic floor. In doing so and increasing the strength of these muscles, it contributes to the prevention of urinary incontinent episodes in the postpartum woman. It is in the greatest interest of women that these evidence-based practices be defined and implemented within the realm of women's health. Now, while the findings of the analyzed studies did confirm the purpose of this integrated review, to discover evidence-based practices to decrease urinary incontinence in postpartum women, we do still recommend that further research be completed.
The purpose of our literature review was to determine if evidence-based interventions were effective in the treatment and prevention of postpartum urinary incontinence. Our main focus were on interventions that strengthened the pelvic floor, reduced the overall number of incontinence episodes being experienced, and if they improved the quality of life of women once they no longer had this experience and the symptoms decreased, or even the episodes decreased, and thus improving their quality of life. We divided the research articles amongst our group and used Johns Hopkins appraisal tools to determine the quality of evidence that was presented to us. And we analyzed various research study designs to measure the outcomes related to the reduction and prevention of urinary incontinence in these postpartum women. Our research showed us that evidence-based practices were effective in reducing urinary incontinence in the postpartum period. Pelvic floor physical therapy and Kegel exercises at home were very effective in reducing the number of episodes, preventing these symptoms from ever occurring, and also improving the quality of life if they no longer had to experience these symptoms or never even had to experience them, thus eliminating it completely in the postpartum period. The studies we reviewed relied on feedback from participants regarding their symptoms, their pelvic strength, their overall quality of life. However, we did only find 16 studies that met the inclusion criteria, and we do recommend that more research be done on this topic using larger sample sizes to review evidence-based interventions, and also just to promote greater awareness and the benefits of therapy once we were able to have larger studies examined and get some more evidence and studies published out there to the public. Completing such an extensive literature review, the task remains to disseminate this knowledge. After completing this review, if we weren't to communicate the findings, then we would be doing a great disservice to many women who could benefit from these evidence-based practices to increase their quality of life and decrease some of these symptoms they may experience in the postpartum period. As previously discussed, nurses have several roles to contribute to in their career in the healthcare profession. One of the most important roles that a nurse can take on is the role of educator. Nurses can educate patients on stress urinary incontinence throughout their pregnancy. In the antepartum world, they can come to the OBGYN clinic for monitoring of their pregnancy, and they can be educated on the importance of Kegel exercises, and also they can even go to pelvic floor physical therapy prior to ever delivering the baby. That way in the postpartum period, they could continue that and hopefully either decrease the amount of symptoms they may experience, or hopefully not even experience any symptoms. In the postpartum period, the nurses in the postpartum floor can also continue this knowledge. Immediately when cleared, if it's okay from their doctors, they can start pelvic floor physical therapy. They can do the education for Kegel exercises at home, and they can educate these patients on the importance of really starting it early versus waiting for symptoms to show up later on. For such education to become a standard in these practices, we really need to get nursing administrators on board. They should offer continuing education courses and information to their staff, to the nurses, on the importance of these strategies and what they can do to help their patients, and just really learn the value of this. Not only should pregnant and postpartum women become educated on the literature, but we also should be educating other healthcare professionals as well. So we need to connect with interdisciplinary teams here. So pelvic floor PT physical therapists are completing that in the OBGYN clinics, and even in a family practitioner clinic. If they come in with a complaint of urinary incontinence, then we also could refer them from primary care. So this isn't just OB and GYN offices that will be doing this. So we really need to educate everyone and get everyone on board, and that way we can be sending referrals to PT, and PT can communicate with us back to what they're finding. If they have certain exercises that they're finding are really beneficial for these women, they could then give that back to us, so that maybe if a woman can't make it to PT, they could be doing some exercises at home. They could be doing some exercises that are safe throughout pregnancy, before they even get to that postpartum and experience any of those symptoms. So really just connect within different teams of the healthcare field, collaborate with them, and just have everyone on board to participate with this. Having a pelvic floor physical therapists even educate patients themselves can also just have them spread this education and this information. They're not just getting it from one person, they're getting it from multiple people, and the importance of this. Marketing tactics such as brochures, we can place that in OBGYN clinics, also can place that in primary care clinics. It can just help get out to the public that this is an option. Many people do not realize that this is an option they can do, and they may just believe they're aging or this is something they have to deal with, but it's not. It is something that we can help. So just let them know that they're not alone. Many people experience this after delivery, and that, you know, it's common. Here's some brochures on it. Here's some options, some home exercises they can do, some physical therapists they can see. And some insurances even will help cover that. So just really spreading that information out there as well. So brochures, talking amongst the different providers again on what they're seeing, getting those referrals out there, word of mouth really from patients and to their family members or friends who might experience this. Once you get one patient in and they see the benefits that this has on their life, the improvement in the quality of life they have, the reduction of symptoms, they're going to tell other people as well. So word of mouth really is a big plan here as far as educating others on it, educating patients on it, and then having them educate others on it in their circle, having them come back to their provider and wonder, is this a good option for me? Absolutely it is. Here's some research on it. So again, just presenting the information that we do have, completing further studies with larger sample sizes can help as well. Getting the information out there. We do know from our review that the evidence does support here that any of these evidence-based practices that we've looked at, the interventions, strengthening the pelvic floor, it can reduce the symptoms that these women feel, and it can improve the quality of life, which is so important. So really just talking to others, referring others, and educating others is such a big part of this. Thank you.